Welcome back to Don't Look Up, where we ask you to look up. Last episode blew up. We had over 450,000 people watch our video on YouTube, a Q&A on Methylene Blue. It was surprising, exciting, and so many of you had questions. So here's our part 2 to dive into some of those questions and answer them as fully and as appropriately as I can. My name is Dr. Scott Sherr, and let's get going. How would Methylene Blue work paired with red light therapy for muscle and bone injuries? Methylene Blue is a fantastic mitochondrial optimizer, and so is near-infrared light, around 680 nanometers. And there have been studies showing that you pair these two things together, you have significant synergy. Why is this the case? Methylene Blue donates electrons to complex 4, or cytochrome oxidase, in the electron transport chain. Red light therapy, or near-infrared, 680 nanometers, also donates photonic electrons directly to the electron transport chain at the same complex, complex 4. So they synergize together, helping you make more energy. If your energy stores are higher, if you're making more energy, you're going to be able to heal tissue better as well. When you have an injury, that tissue is inflamed. It has a hard time making as much energy. So Methylene Blue comes in and helps with the energy production side and also helps with the detoxification side as well. And so red light therapy in combination is going to help synergize and help you make more energy in totality. So for muscle, for bone, for any kind of injury, Methylene Blue may be helpful in combination with near-infrared light as a way to synergize and enhance energy production and detoxification. Can you OD on it? Does your body get used to it and you need to slowly get off it so that your neurotransmitters aren't swirly? Can it cause serotonin issues? What happens to your body when you stop taking it? So I think the real question here is what happens to your body when you stop taking Methylene Blue? In general, Methylene Blue is not something you can become dependent on. It's something that's supporting the system overall, and it doesn't have the capacity really to do the tolerance, withdrawal, dependence that a lot of addicting drugs will. Most of those drugs are working on neurotransmitters and depleting them to a significant degree. And also, those drugs also have a significant reward factor with the dopaminergic side of things, the dopamine. So Methylene Blue does increase serotonin, norepinephrine, and dopamine, but in a more balanced way with those three neurotransmitters. So it doesn't have that same risk profile as it would for other addictive drugs potentially. And then what Methylene Blue really is doing is supporting the mitochondria, right? And as a result of that, it's helping reboot it and regenerate it. So if you're doing that along with the context of helping with your diet, lifestyle, supplementation, working with a provider, et cetera, you should be able to wean it off over time without a significant issue. Now, that being said, if you're taking a very high dose of Methylene Blue, as I was just alluding to, I don't recommend stopping it cold turkey. I recommend slowing it down over time. And most of the colleagues and myself as well, the way we do this is that if we're at a higher dose, we're going to wean them down over 3 to 5, maybe 7 days before fully stopping it. And that just prevents the system from going into a rebound type of effect, which I haven't really seen very much, but I guess it's theoretically possible. With regards to potentially ODing on Methylene Blue, you can take too much Methylene Blue, no doubt about it. Once you get to above about 2 milligrams per kilogram, and especially 3 milligrams per kilogram, this is the equivalent of about 200 or 150 milligrams to 300 milligrams of Methylene Blue orally. These doses build up in the system over time. Even one dose at 3 milligrams per kilogram, especially in the IV, can cause significant havoc to the system, causing the opposite of what it does at low doses. At low doses, it increases mitochondrial support. It helps with energy and detox. But at these very high doses, it becomes a significant oxidative load or a stress on the mitochondria itself. And so it's used at these very high doses for significant trauma, sepsis, cardiopulmonary arrest, and it can be used as a last-ditch effort in those cases and sometimes be successful. But in essence, you don't want to be taking those high doses over long periods of time because it can build up in the system, because of the half-life. The half-life of Methylene Blue is about 4 to 6 hours. So you're taking over about 100 milligrams of Methylene Blue a day. You are going to see build up in the system overall. So in essence, what you really want to be thinking about here is using your lowest viable dose to see the effect that you need. And then if you need to increase the dose, try to do it for short periods of time. What would happen with these high doses is that you can start feeling pretty poorly. If you start getting more oxidative stress, your body's going to suffer. You're going to have more pain, more discomfort, more inflammation. At the lower doses, this doesn't happen as much at all, except for maybe on the detox side, you can have some of that, but these high doses can very significantly cause severe issues to the system. So just be aware of that. I'm taking your Methylene Blue. I absolutely love it, and I can tell it's really working by how it makes me feel. I heard you say that you do 5 days on, 2 days off. I'm just taking 4 milligrams only in the morning. Is there any reason I shouldn't take Methylene Blue every day? So Methylene Blue at these low doses is extremely safe. 4 milligrams, 8 milligrams, 16 milligrams, very, very low dose. They do not build up in the system with this kind of dosing. Once you get to about 70 milligrams of methylene blue or higher, that's when you might see a buildup of methylene blue in the system. And if that's happening, you do want to take time off, at least a couple of days off a week if you don't want to cycle off of it. But the key is to understand why you're taking methylene blue in the first place. If you're taking it for a chronic issue, mitochondrial support, you may need to take it regularly before you get to the point where you can start weaning it down. How do you do that? Well, you look at optimizing the mitochondria in other ways: your diet, your lifestyle, exercise, stress, toxins in your environment, toxic relationships, people that snore next to you in bed. These are not good things that are good for your mitochondria. And so the key is to understand that methylene blue is not a cure-all. It can help optimize the mitochondria and reboot it, but the key over the long term is to help reboot your mitochondria, doing the harder work, optimizing your lifestyle, your diet, your supplementation. And this is not easy, okay? It can take a long time. So methylene blue can help you right now while you're on that longer path to healing. And that's why it's so awesome. But as you get more optimized, as your mitochondria become more optimized over time, you'll need less methylene blue to help you. In some people, this might be something that you need to take for just a couple weeks regularly before you can wean it down. In other people that are taking it for a chronic complex medical issue, it might be longer. And that's okay. At these low doses, it's totally okay to keep it going at these regular clips, daily even if you need it, for the time that you need it. So over time, you can wean it down, as mentioned. But if you've been taking it for long periods of time for a chronic issue, that's going to be okay as well. Now, if you're on the higher end of the spectrum, if you're taking more methylene blue, over 30 milligrams a day, I do recommend taking at least 1 day off per week. Higher than that, 70 or 80 milligrams, even more days off per week. If you're taking an antidepressant, how long should you wait after stopping your antidepressant before transitioning to methylene blue? The challenge is that antidepressants in general are extremely long acting. So every antidepressant is going to be different. Some will last just a couple days. Others will last months before they completely come out of your system. So it's very important to know what antidepressant you're taking and to work very closely with your healthcare provider before stopping an antidepressant. Oftentimes you want to wean these down with the close supervision of a healthcare provider. Now, that being said, I do have a couple colleagues that are integrative psychiatrists that have been able to do this, wean their patients down on their antidepressants while slowly starting their methylene blue in its place. Now, this is not something you want to do on your own, okay? This is something you want to do with a healthcare provider facilitating the process. It can take a long time to come off an antidepressant. That being said, we do have studies showing that methylene blue can help in depression and bipolar disorder. There are small human trials that have shown this, though. And so oftentimes when you start taking methylene blue, when you're not on an antidepressant, you will feel an increase in your mood. I have a good story for this. I was just talking to a colleague of mine that was working with somebody that had just lost their spouse not too long ago. And they were just not doing well. They were having depressed mood. They weren't clinically depressed from a major depressive disorder, but they weren't getting up and going. They just weren't doing what they would typically do. And all she did was give him 4 milligrams of methylene blue. And all of a sudden, his mood got better. He was more motivated. He was more active. And I've seen this time and time again. It can just give people that little bit of a mood bump, that little bit of an energy bump because of how methylene blue works, right? It does work as a mitochondrial optimizer, increasing energy, detoxification, but it does have an increase also in serotonin, norepinephrine, and dopamine. This is why you have to be careful with methylene blue if you're taking an antidepressant or medications that also have an effect on those particular neurotransmitters. But at the same time, that's why it does help with the mood to some degree. Mood elevation is a part of taking methylene blue, and it's that boost that many people need. Be careful if you're taking antidepressants. Work with a healthcare practitioner, wean them off slowly, and hopefully over time you can come off the antidepressant if that works for you. And methylene blue might be a way to support your mood, support your mitochondria at the same time. I've read that methylene blue blocks nitric oxide. This is a very important question. I'm going to go through it in detail because so many of you have had questions about nitric oxide and methylene blue. What's most important to realize is that nitric oxide is produced in different areas of our body. There's something called inducible nitric oxide, endogenous nitric oxide, and then neuronal nitric oxide. It's all produced by the same enzyme, nitric oxide synthase. Where this enzyme is being activated depends on the type of nitric oxide that you have. Inducible nitric oxide, or nitric oxide synthase, is induced when you have inflammation, infection, trauma, or severe stress. This nitric oxide is produced inside of your vascular system. It is free-floating, it is hanging out, and it causes inflammation, pain, low blood pressures, inflammatory cascades, not good things. Now, we need some of this nitric oxide inducible when you have an infection or stress to help signaling to allow your cells or your system to start reacting to the stress that you have. But too much nitric oxide synthase inducible, producing nitric oxide that's free floating, can cause significant stress in the system. And then there's endogenous nitric oxide synthase. This makes nitric oxide in your vascular wall, in your endothelium, as well as in your mitochondria. This is the nitric oxide that all of you are talking about when you ask me about whether methylene blue is affecting nitric oxide. This endogenous nitric oxide is extremely important for longevity, for heart health, and also there's the neuronal nitric oxide that's very similar, that's produced in the brain, that helps our brain function as well. So let's talk about how methylene blue affects nitric oxide in all these locations. Methylene blue has a significant impact on inducible nitric oxide synthase. It prevents nitric oxide being released in circulation, no matter the dose. Low doses will do it less. High doses will do it more, okay? So if you have inducible nitric oxide that's being produced from this nitric oxide synthase, you don't want a lot of this. It's going to cause inflammation, pain, low blood pressure. So if you can prevent nitric oxide from being produced in circulation, you're gonna have less inflammation, less pain, and less low blood pressure. So this is a good thing. The higher the dose of methylene blue that you use is going to have a higher impact on the inducible type of nitric oxide that's being produced overall. Next, we have endogenous nitric oxide. Low doses of methylene blue, 4 milligrams, 8 milligrams, 16. These do not have a negative impact on the amount of endogenous nitric oxide produced. In fact, there are some studies that show that these low doses might have a positive effect on endogenous nitric oxide production. Why? Because when you have more methylene blue in the system, 4 milligrams, 8 milligrams, 16 milligrams, what's happening here is that it's increasing ATP production, energy production, which stimulates your mitochondria to dilate blood vessels around the cells that are making more energy by secreting nitric oxide, and then getting more substrate, getting more of your glucose, your fats to that area so that you can make more energy and then maintain that energy production. So there is some evidence that low doses of methylene blue, 4 milligrams, 8 milligrams, 16, these low doses will enhance endogenous nitric oxide production because you need to make more energy because you have more methylene blue around. Nitric oxide is being released to help dilate blood vessels in the area to get more substrate to the tissue. The same thing is true for neuronal nitric oxide. The same thing goes at the same doses. The difference is this. Once you get to above a milligram per kilogram of methylene blue, especially IV, you start having a detrimental effect on the endogenous nitric oxide supply itself. So the endogenous nitric oxide supply is going to be neutralized by these higher doses of methylene blue. So you have to be aware of that overall. So what is a high dose? I said around a milligram per kilogram, but anybody that's taking about 30 milligrams or above of methylene blue, what I'm going to do just in case is start supporting them or supplement them with some nitric oxide boosters. There's many on the market. So if you're taking a higher dose of methylene blue, especially for a longer period of time, over 30 milligrams is usually my rule of thumb, then consider taking some nitric oxide boosters at the same time to address the endogenous nitric oxide supply. Another question I often get is that methylene blue is increasing blood pressure because it's binding up this nitric oxide. Now, that is the case if you're taking high doses of methylene blue, again, over the 30 milligrams, but especially over a milligram per kilogram. But these lower doses, 4 milligrams, 8 milligrams, 16 milligrams, are not binding up that endogenous nitric oxide supply. They may bind up the inducible nitric oxide supply, and that's a good thing. So if you have low blood pressure, you have positional hypotension and tachycardia, and you have low blood pressure, you have low blood pressure because you have a lot of free-floating inducible nitric oxide. So blood pressure going up as a result of taking methylene blue is in part because you're binding up that inducible nitric oxide. In addition, what you're doing with methylene blue, even at these low doses, is that there's some element of norepinephrine, dopamine, and serotonin release because methylene blue works as a monoamine oxidase inhibitor. So because of that, because of those neurotransmitters, especially norepinephrine, you are going to have an increase in blood pressure. This is very, very mild, if negligible for most people. However, if you already have a blood pressure problem, if you're already taking blood pressure medications, then you may see a rise in your blood pressure even at very low doses of methylene blue. This is not because of nitric oxide. This is because of the norepinephrine, dopamine, and serotonin that's being released as methylene blue as a monoamine A, so monoamine oxidase inhibitor, monoamine A inhibitor. So in the end, to sum up, low doses of methylene blue have an effect on neutralizing inducible nitric oxide, the free-floating type that comes with stress and infection and trauma, and has a positive effect on endogenous nitric oxide supply and neuronal nitric oxide supply because it's enhancing energy production and allowing more substrate to get to the area that's required to continue to maintain that energy production upgrade. Higher doses of methylene blue, over a milligram per kilogram for sure, but even above 30 or 40, I do start thinking about it. It will definitely bind up inducible nitric oxide or prevent nitric oxide synthase from making more inducible nitric oxide, but it also may have a detrimental effect on endogenous nitric oxide supply. So be aware of that. Think about supplementing with nitric oxide boosters at the same time as taking those higher doses. There you go. How long before you start feeling the positive effects? I also have had many TBIs in the military and researching methylene blue now. So typically when you start methylene blue, you should start feeling the effects when you get to the dose that works best for you. It's not something that builds up in your system. There are other medications and supplements that they say, start it and just let it build up in your system and see how you feel. That's not the way methylene blue typically works, at least in our clinical experience. Typically, you'll find that methylene blue, once you find the right dose, is going to start giving you that shift. Now, that shift might be subtle in the beginning. You might feel in the beginning a little bit of mood elevation, a little bit of energy. You might want to continue to increase your dose just a little bit to see if there is an increase in improvement from there. But once you've found your dose, that's your dose. Either you take it regularly because you need it, or you take it more intermittently because you just need it more as needed for certain things that you'd like to do, like endurance, for example, or heavy workouts at the gym. If you're taking it more for a chronic, complex medical issue, you may need to take it more regularly, as we discussed earlier. And that might be for 2 weeks, it might be for a month. It just depends on the situation. But oftentimes, after a period of time, you can start weaning it down. When it comes to issues with the brain specifically, the brain is chock full of mitochondria. You have your most mitochondria per cell in the eggs and sperm, and then in your brain. Your brain also takes 20% of your body's oxygen consumption. So it is a huge amount of energy and metabolism that's required all the time to make your brain work better. If you've had injuries to the brain, oftentimes those injuries don't heal completely because the brain doesn't have the ability to heal like your knee does or your toe. What happens when you injure your toe or your knee is that it can swell. Swelling allows all the sort of white blood cells and things like that need to get to the tissue get there easier. The brain, because we have a cranium, a hard bone that covers it, doesn't allow us to swell. And so as a result of that, we don't get complete healing in the brain. So oftentimes we have this semi-functional tissue, this periischemic, this pericontusional, like the area around the injury that doesn't completely heal. So what methylene blue can potentially do there is help reboot the mitochondria in those areas and reboot the mitochondria, reboot the cells, make them work better. So in essence, what we can do here is help with the rebooting, with the energy production, with the detoxification, and then in combination can really, really help the brain overall. So some of the main things that people will feel once they start taking methylene blue at these low doses, brain fog can go away, concentration significantly improved, attention significantly improved, just feeling more elevated and more plugged in, not locked in like you're super focused like on a stimulant per se, but just more elevated and just more able to conquer whatever it is you need to do that day. Are some people non-responders to methylene blue? I've been using it for nearly 2 months now, dosing from 1 to 40 milligrams. I haven't seen any benefits with brain fog, fatigue, or mood. This is also a great question. What I often say is that if methylene blue is not working for you and helping, it may mean that you just haven't gotten to a high enough dose yet. Even 40 milligrams is a relatively low dose. Some of the studies show that you won't start seeing a benefit until 70, 80, 100 milligrams of methylene blue. Now, if that's the case, you should definitely be working with a provider to help you modulate your dose. And also look what else might be happening under the hood. Methylene blue is not going to be a cure-all. It might help under the hood here, support the mitochondria, but there may be other things going on, like the gut has significant issues, or there's significant neurotransmitter derivations from normal, or there's significant stress in the system, toxic relationships, other kinds of things, trauma that are going to prevent you from seeing the benefits overall. I've worked with tons of people over the years, and if there's a trauma component to it, a significant psychosocial component, oftentimes you just don't see the response that you'd expect, even from something that's as powerful as methylene blue is. So in the context here, I would recommend considering going to a higher dose. If the higher doses aren't working and you're working with a healthcare practitioner, it may mean that something else is going on, especially psychosocial. I found that can really be sort of blocking the system from seeing the benefit of using it. Can it help with chronic fatigue syndrome? I've been bedbound for 3 years. Nothing has helped. Please, I'm at my wit's end. This is a difficult one. Chronic fatigue syndrome, fibromyalgia, long COVID. These are people that are suffering significantly. And methylene blue, what it does, as we've been describing here, is work in the mitochondria. It can help reboot the mitochondria. It can help bypass various areas in the mitochondria that aren't working as well as they should. Oftentimes, when you have a complex medical illness, you have severe mitochondrial dysfunction, often on the electron transport chain. The electron transport chain has these complexes 1, 2, 3, and 4. 1 and 2 are the most important from the respect of helping us take energy from the food that we make and get it into the mitochondria to help us make that ATP, that energy currency that we all need. What can happen when you have a chronic inflammatory state is that these complexes 1 and 2 aren't working very well at all. So what can we do here? We can use something like methylene blue to bypass these dysfunctional complexes, donate electrons further down the chain to complex 3 or complex 4. And as a result of that, you can start seeing energy production for the first time in a long time. I'm not making any claims that methylene blue treats chronic fatigue syndrome or fibromyalgia or long COVID. What I'm saying here is that there's a mitochondrial aspect to almost any chronic complex medical condition. And that's where methylene blue can come in and support the mitochondria. There's no guarantees, of course, that this is going to help anybody. But what I've seen in clinical practice is that you can start methylene blue very low doses and titrate it up very slowly in people that are really sick. In some people, they couldn't tolerate anything else. They couldn't tolerate supplements, dietary changes, let alone a walk around the block. But just a little bit of methylene blue, 2 milligrams, 4 milligrams, taken in the morning and sometimes twice daily, a little bit in the afternoon too, suddenly gives them a little bit more energy, a little bit more focus. They can start taking care of themselves a little bit better and start getting on a better diet, optimizing their supplements, changing their lifestyle. So it can be kind of like a cornerstone supplement, a cornerstone product that can help, just like exercise is a cornerstone habit. Once you start exercise, everything else gets easier. And the same thing can be for methylene blue as well. My friend who has ADHD swears by methylene blue. He got off meds. I'm not making any claims here that methylene blue treats ADHD. What we're talking about, again, is mitochondrial function and also neurotransmitter optimization. Methylene blue works by increasing serotonin, dopamine, and norepinephrine. It also works by enhancing mitochondrial function, energy production, detoxification. So many people that take methylene blue will feel their mood get better, their energy get better. And oftentimes, stimulant medications are doing very similar things, except the problem with stimulant medications is that they're clocking the system over the time. They're taxing the system over time. They're making all these neurotransmitters come out, especially dopamine, and then the system has to rebuild itself. But this is why you get your crash. You take your stimulants and then you feel terrible afterwards. The beautiful thing about methylene blue is it works to enhance the mitochondria and support mitochondrial function at the same time as it's increasing those neurotransmitters. So you have this sort of dual action. That's why we call methylene blue a blue tropic. So there's different types of nootropics, things that enhance your brain to work. Nootropics can be in different categories. There's health optimization nootropics, things that support the brain. Something like L-tyrosine, for example, is an amino acid that increases your dopamine over time. Then you have things like performance optimization nootropics. These are ones that enhance the system but are not necessarily healthy for the brain. This is something like your Adderalls, your Vyvanses, nicotine, caffeine. These are things that stimulate the system in various ways, but they're not necessarily healthy for the brain or the cells. The cool thing about methylene blue, as I just mentioned earlier, is that it can do both. It helps support the system by energy production, detoxification. There's very few compounds out there that both enhance energy production and detox at the same time. Most things are going to give you energy, but not detox, or give you detox, but not energy. Methylene blue does both. It's called a redox cycler, and that's one of the ways that methylene blue is so special. So in essence, what we're doing here is that we're optimizing neurotransmitters, and then at the same time, we're optimizing mitochondrial function by that energy detox cycle. So this is why people feel better. And if you're thinking about your stimulant medications and coming off of them, please do that with the support of a healthcare practitioner. There are healthcare practitioners that will be very, very willing to help you get off your Adderalls, your Vyvanses, your stimulants, and get on something like methylene blue, but that should only be done under the supervision of a healthcare provider. How did I get to 65 years old and just now learn about methylene blue? I search out good health info all the time. I definitely need help with energy. Well, this is very common. So many of us need help with energy. As we get older, we just don't feel like we had the energy when we were 21 to 30 years of age. Why is this? Well, there's lots of reasons why, of course, but the common denominator for almost all of this is mitochondrial function. These mitochondria are so important. And as we get older, the enzymes, our ability to utilize our mitochondria in an efficient way goes down. And this is because of aging. Now, what is aging? Aging is the buildup of toxins, stress, hormonal issues, and so many other things that are happening, of course. Insulin resistance is a big one. And so as we get hit by these things over and over again, our mitochondria become less efficient. And so energy is one of the things that we first feel goes down. Mitochondria are chock full in our cells, in the eggs, in the sperm, in the brain, as I mentioned before, but also in your heart, in your liver, and your musculoskeletal tissue. So exercise-induced fatigue is almost always at least a significant component related to mitochondrial dysfunction. So you have to keep mitochondria always in mind. Now, fun fact, there's only one cell in our body that does not have mitochondria. That's human. That is our red blood cells. Our red blood cells actually did have mitochondria, but over time, as they mature, they release their mitochondria so they can make more room to carry oxygen, which obviously is what our red blood cells do. So energy is such a universal issue. It's so common for people to come to my clinic, or my telemedicine clinic at least, and say, I need more energy, I need more focus, I need more concentration. I can't exercise the way I used to. And so methylene blue can be a component of helping reboot the system, optimize energy production and detoxification. But it's not the only thing, of course, right? We have to think about what's going on under the hood. We have a nonprofit at Troscriptions called Health Optimization Medicine and Practice, or Home Hope for short. And what that really is a clinical framework that was developed by our founder and pioneer, Dr. Ted, that looks at optimizing cellular function, real-time foundational health metrics. Take the disease out of it. Focus the perspective on health. There's nobody taking care of the basic cell. That's what we do at Health Optimization Medicine and Practice. There's nobody looking at it from a health perspective, how to keep people healthy, rather than just treat their diseases and illnesses or find the root cause of them. So the deal here is this. Energy is such a common complaint. Got to look under the hood, not just at something like methylene blue, which can certainly help, but what's happening with your cells, what's happening with your gut, your neurotransmitters, your hormones, and shifting the perspective from disease and focusing on health. And what we've done at Home Hope is create the first standard of care for health. There's tons of standards of care for disease. We've created the first standard of care for health. New to methylene blue, USP grade for about 10 days. After 5 days, I experienced what I believe is a detox phenomenon. Liver, pancreas, kidneys were throbbing. Did I experience detox? This is a fantastic question. And the answer is probably yes. The way I think about methylene blue is almost like an adaptogen, in the sense that it can help with energy production, or it can help with detox, primarily depending on what's required. And what happens when you detox? You start binding up inflammation. You start binding up free radicals. When you do this, the body starts to need to get rid of these free radicals, these oxidative molecules. And that requires the system to detoxify. And so symptoms like joint pain, inflammation, headaches, irritability, these are your detox kinds of symptoms. You can absolutely get these with methylene blue. If you start off at a low dose though, if you start off at 2-4 milligrams and go very slowly, oftentimes these symptoms are pretty mild. The challenge out there is that there's a lot of products that come in liquid or other forms that are telling you to take 50, 70, 80 milligrams of methylene blue off the bat. This is just going to set you up for a world of hurt, especially if you have a lot of detox to go. And so oftentimes in my clinical practice, if I know that somebody has a lot of detox ongoing, what I'm going to do is support their detox pathways. Not only am I giving them methylene blue, but I'm thinking about antioxidant repletion, like your glutathione or vitamin D or melatonin, which is a fantastic antioxidant. Most people don't know that. But also binders as well, activated charcoal, clays. These can be very, very helpful as well. So in the end, you don't want to do this on your own, typically. You really want to work with a healthcare provider that knows detox well, and then you can use methylene blue as a detoxifier in this capacity and see fantastic benefit. Because what often happens after you go through a little bit of that detox, that some of the pain, the discomfort, the inflammation, the irritability, on the other side of that is fantastic. And I've seen this time and time again. The key is to support people in my clinical practice while they're going through that detox phase. Once you do that and they get to the other side, it's fantastic oftentimes how people feel. There were also a lot of comments on our YouTube video that we were talking about methylene blue as this cure-all, that it could treat everything. And anybody that said that something could treat everything was lying in some way or not telling the truth. And I hope I was clear on this Q&A, giving you the nuances overall. Methylene blue can be fantastic in supporting mitochondria, in doing the things it does, decreasing inflammation, detoxification, neurotransmitter balance, higher doses for acute issues for sure. But it's not the only thing around that can help. And in fact, what I often do with methylene blue, as I alluded to earlier, is I use it as I'm working with people to help optimize truly from a vitamins, minerals, nutrients, cofactors, using our health optimization medicine and practice approach, focusing on health, not focusing on disease, optimizing cells. What you're really seeing now is precision cellular medicine. That's the next generation of medicine. You're seeing it now, metabolic care, cellular medicine, precision medicine. You're hearing these words, you're gonna hear them more. And Methylene Blue is one of those tools in the toolbox that can really help people quickly while they're on the longer path to optimizing their health. Not everybody, that's for sure, but many people can benefit. Why? Because it's a mitochondrial optimizer. And mitochondria are such a problem and challenge for 94% of the United States population that has metabolic and mitochondrial dysfunction. So is it something that can be used in a lot of people? I would say yes. But is it the only thing? No. Is it the first thing? No. Is it the thing that should be on forever? Absolutely not. My stance here is that we live in a synthetic world. And sometimes we need things that are not from the earth, like Methylene Blue, to help us along the process. Not everything natural is good for us. Not everything synthetic is bad for us. And I will be clear, Methylene Blue is a synthetic compound. It doesn't come from the earth. I've seen people die of natural compounds all the time. You forage for the wrong mushrooms, you will die potentially of liver failure. Not everything natural is good for us. Not everything synthetic is bad for us. We live in a synthetic world under bad lights, toxic food, toxic relationships. It's not all easy. And we don't live like we did in Paleolithic times. So Methylene Blue has a role, and it has a fantastic role in supporting mitochondrial function. So I think many people can benefit from it, at least in the short term, and then intermittently when they're under more stress. They're on an airplane, they get a bad night of sleep, they feel like something's in the house and you might get sick. These are all ways that Methylene Blue can be helpful. So always taken in context, and that's how I think about Methylene Blue in my own clinical practice. You asked, we answered, and this is just the beginning. Thanks so much for listening to this video and learning with us. That's what we do here at Troscriptions. This is an educational channel. We're going to be giving you information on science, tools, techniques, processes, but from a clinical perspective. There are 4 docs on my team, including me. Collectively, we've seen thousands of patients. We're going to give you the clinical experience, how things work in clinical perspective. The challenge out there is there's so many people giving you advice and ideas and protocols, but so many of them are not grounded in a clinical understanding of how it works when you work with patients directly. That's what we do every day. That's what we're going to do here at Troscriptions, and that's what we're going to do for you. So drop your questions below, and as always, keep looking up.